Hi, I'm Catherine, one of the nursing subject matter experts with NCLEX Mastery. We're going to talk briefly about answering prioritization questions. Answering prioritization questions needs to be done following a certain method. Whether you choose this method or one that suits you better, this is a good way to organize how you think about these types of questions. First, read the question in its entirety. The nurse assesses a client after a renal arteriogram. The nurse palpates the right groin access site. The client then reports right calf pain. Which action does the nurse take first? Obtain vital signs and compare with baseline. Assess perfusion in the right lower extremity. Notify the healthcare provider of the client's status. Administer prescribed analgesic medications. Consider your priorities in organizing your care for this client. Look at Maslow's hierarchy first. All of the needs for this client appear to be physiological in nature. If all of the needs seem to be physiological, then you must default to looking at airway, breathing, and circulation issues next. Read the question stem. Pay attention for any keywords such as first, most important, best, priority, initially. Those indicate that it is a prioritization question. That means all of the answer choices are going to be correct actions. They're going to be things the nurse should consider doing. Now, do kind of a quick brain dump. What did the question ask you about? What do you know about renal arteriograms? What do you know about postoperative care? What do you know that might be relevant to this question, including all the issues that might occur with airway, breathing, or circulation? Begin to organize your thoughts according to those ABCs. After a renal arteriogram, many issues of circulation might be present. Now clear your head. What did the question actually ask you? Determine what is important or what stands out. What are you being asked? The client is reporting pain. This means the client is likely breathing adequately. The pain is where? It's not at the surgical site where you might expect some minimal pain, but it's in the right calf. This is not normal and indicates something urgent. The nurse might consider that the client is experiencing complications such as arterial spasms, pseudoaneurysms, thrombus at the site, or arterial dissection, for example. So what will the nurse do first? Examine the answer choices. Obtain vital signs, assess perfusion, notify the healthcare provider, or administer medication. Choose the option that best fits the scenario. What action will the nurse take first? The nurse will first assess perfusion in the right lower extremity. A focused assessment based on the client's reports is essential. After doing this, the nurse can obtain vital signs if that hasn't already been done, notify the provider, and depending on what the provider says, the nurse might administer analgesic medications for the pain. Have a method for answering prioritization questions. First, read the question in its entirety. Consider your priorities according to Maslow's and the ABCs. Reread the question stem, and then do a brief brain dump, considering what you know about what you were asked. Organize your thoughts, again, according to Maslow's and ABCs that are relevant. Clear your head, and then reconsider what you were asked in the question. What was important? What stands out? Examine the answer choices and choose the option that best fits the scenario, keeping in mind that a prioritization question indicates that all the answer choices are likely correct. If you found this useful, check us out on Facebook at Nursing and NCLEX Mastery, on our NCLEX Mastery blog, and look for other apps like ACLS Mastery and Nursing Clinical Mastery. Study on!